Hello, everyone. On February 16th, we had a TaylorMD Formulations webinar, and for some reason it didn't record. So I'm going to provide everybody with a summary of what we talked about. Uh, Initially, we talked about PPIs, proton pump inhibitors, and dementia, a recent story that was run on most of the major news stations, and reviewed how amino restore and enzyme restore would help eliminate that risk because one, you could get them off of the PPIs and allow them to be able to digest their food and also amino restore. So we're going to talk about that. We also talked about the trend in decreasing insurance reimbursement, and I introduced a cash procedure called strawberry laser for inch loss, and also adding some of our TaylorMD formulation products to help with weight loss. And then we also talked about BHRT certification coming on April 15th and 16th. And we're going to send out registration information about that as soon as possible. So let me just go through this, and you'll be able to get the gist of what we talked about. So recently they were talking about how PPIs are associated with increased risk of dementia. I think a 40% increased risk of dementia. And we talked about that if you know physiology, this is not very surprising, because if you don't have acid in the stomach, you're going to be unable to break down proteins. And we know you need proteins in order to make amino acids, and amino acids makes neurotransmitters. And if you don't have enough neurotransmitters, you're not going to transmit messages between neurons. And that's primarily what dementia is. You're unable to store and retrieve memory. And these are all messages that are carried by neurotransmitters. And if any of you have a heart rate variability, you'll be able to see that most of these people on proton pump inhibitors have low total power, which indicates low amino acids. So as you get older, your stomach acid decreases anyway. Most of the time, these people do need increased stomach acid and digestive enzymes. So our products, Amino Restore, would allow them to absorb amino acids without having to break down protein. And also, our enzyme Restore has hydrochloric acid and digestive enzymes. So these are two things that you could switch your patients to who are on proton pump inhibitors, whether they're young or old. So then we talked about the strawberry laser. The strawberry laser is something I brought into the office back in October of last year, and now I have enough experience with it to really recommend it. The strawberry laser is what you do is it's two um, 10-minute treatments, or 1 20-minute treatment, and you do it anywhere from 4 to 8 times. And this is a person who received 6 treatments. What it is, it's a cold laser. It's not doesn't cause any pain at all. And I'll show you in some slides coming up. But these are the results that we've been getting. This is someone who's had 8 treatments plus used our weight loss program. She lost a total of 26 pounds, and we're going to do some more treatments to try and tighten up that skin. This is a person who had 6 treatments. This is initial, this is after 3, and this is after a total of 6 treatments. This is a person who had 4 treatments. This is another person who had another 4 treatments. Patients have really been excited about it, really happy about it. I've had it done, lost about 4 inches off my waist, primarily with my love handles. Uh, so what it does is the laser actually penetrates the adipocytes. And what happens is water, glycerol, and free fatty acids move out of the adipocytes and into the interstitial space. When you release these fatty acids, this becomes free energy. And glycerol and free fatty acids are free energy. And so what you have to do is you have to burn off that energy. That's the problem, is that this fat is trapped in the adipocytes, and it's hard to burn off when, just from workouts or whatever. So once this is released, It's free to be used. So the patient should go and go and participate in some type of aerobic exercise for about 20 minutes within 12 hours of the treatment. Also, they're on a total body vibration machine for 10 minutes. It helps to move this fat down toward the lymphatics. So the more treatments you have, the more of this free fat and glycerol and water are released, and the adipocytes are shrink, but the blood vessels and the nerves and the interstitial uh, structural tissue is not harmed at all. So it works very well. Now, what we suggest is that in order to use this free energy, that you use our product called MIC-B that has alpha lipoic acid and L-carnitine. And you know, L-carnitine is needed for you to transport fat into the mitochondria so that it can be used for energy. Also, we know that fat can have toxins in it, so we recommend that you give the patient green med as a detoxifying agent for them. You can also do a BIA we do BIAs prior to doing the strawberry laser so we can see how toxic the person is. If they're very toxic, we may also suggest the Detox RX to make sure that they're not harmed by the toxins that may be released in the fat. Uh, One of the contraindications if a person has liver or kidney problems, they really shouldn't do it because they may not be able to handle the toxic load. And then we also always recommend Amino Restore because it'll help them change their eating habits, help them with cravings. It will also help them to build muscle because you also want them to be able to maintain this weight loss. And they do. Most of the patients, it gives them even more of an incentive to eat right and exercise because they don't want to have to do this again. Now, and you can do this strawberry laser on any body part. I just showed abdomens. You can do it on thighs, you can do it on arms, you can do it on man boobs, you can do it on back fat, you can do it on calf fat. It's really, really a cool procedure. If you want more information, just email me at info@TaylorMDFormulations.com and I'll get you in touch with the appropriate person for your area. So that was about it. Also, the BHRT certification is going to be on April 15th and 16th. I have another video to kind of explain what that's going to be about. Uh, I've been talking about BHRT for about, I can't believe it, for about uh, 16, 17 years. And I think that some of the teaching is kind of getting out of hand. And I want to be able to make sure that you can do this and do it right. So I'm going to be sending out information about that, and I'm going to try and continually um, um, provide these small little teaching videos so that we can stay in better touch with each other. So thanks a lot for listening, and look for the next webinar. We're going to try and do this every 2 to 3 weeks. So thanks again, and I hope this was helpful.